Hi, this is Group I, and our presentation is about the perception of nursing students' clinical experiences and readiness for practice. And this is done by Heywan,
Alexis,
Enzo,
Francis.
and Rachel.
Our objective is how prepared do student nurses at APU feel for practice post-graduation based on their clinical rotation experiences. First, we need to answer the question of why this is important. First of all, clinical rotations are a vital part of any nursing program, and also they prepare students for practice.
Thirdly, as students begin to expect clinicals within the next semester, it is important to understand the struggles and strengths that upperclassmen had in order to monopolize the time we spend throughout our clinical rotations. Our target population is the student nurses in the traditional undergraduate program at APU who have started their clinical rotations.
The data collection of method of sampling was the snowball sampling, and this is where we were asking a few upperclassmen to fill out the survey, and it was in the existing participants recruit others from their network.
problems that we had in collecting the data was that we had insufficient responses. We had 33 responses when we were aiming for 50. And another was that a significant number of respondents were not part of the target population. More than 10 of the responses were from first semester freshman students who have no clinical experiences, so it did affect the efficacy of the data.
Hi, this is Enzo Lee. For our first hypothesis testing, my research question was, is there a significant relationship between the number of completed clinical rotations and how well do students feel prepared for their nursing job post-graduation? My null hypothesis was there is no significant relationship between the number of completed clinical rotations and how well students feel prepared for their nursing job post-graduation. And my alternative hypothesis was that there is a significant relationship between the number of completed clinical rotations and how well students feel prepared for their nursing job post-graduation. The relevancy of my research question and the topic of our project is to see how clinical experiences affect the perception of student nurses' readiness for practice. We compared the number of clinical hours and the preparedness of the nursing student for post-job graduation. I chose the Spearman's role correlation test to examine the hypothesis. According to the descriptive statistics table run by SPSS, it showed that the data is not normally distributed with the variable preparation for post-graduation, having a skewness of negative 1.463 and kurtosis of 2.606. Because the Spearman's role correlation test is a non-parametric test, it does not require the assumption of normality. And that's the reason why I chose the Spearman rules correlation test. The result of the test was that the data had a p-value of 0.165, which was greater than 0.05 of significance level, and the correlation coefficient was 0.248, which falls below the critical value of 0.356. Therefore, there is no significant relationship between the number of completed clinical rotations and how well students feel prepared for their nursing job post-graduation. Therefore, we fail to reject the null hypothesis.
Hypothesis testing number 2. In my hypothesis, I was testing the relationship between the variables total hours of patient care experience and confidence in handling high-pressure situations in nursing students. The null hypothesis was that there is no significant relationship between the total hours of patient care experience and confidence in handling high-pressure situations. The alternative hypothesis was that there is a significant relationship between the two variables, total hours of patient care experience and confidence levels in handling high-pressure situations. This hypothesis is relevant to our overall topic because an aspect of practicing nursing in the real world is having the aptitude to handle high-pressure situations. These are frequent in clinical settings, especially in the field of nursing. Also, clinicals require lots of patient care interactions. Therefore, these two variables relate to our overall topic of readiness for practice among nursing students from clinical rotations. In this case, we were testing for monotonic relationships, so we used the Spearman's row correlation test. The assumptions were that the variables are normally distributed and that they have a directly proportional relationship. If we see in the results of the test, there is a positive correlation between the two variables, and for this test, we had an alpha value of 0.05. The Spearman's row correlation test revealed that there is a weak positive relationship between the hours of patient care experience and confidence levels of nursing students, with an R value of 0.17 and P value of 0.36. This indicates a weak positive relationship because the correlation coefficient is less than 0.8. Therefore, we're able to reject the null hypothesis and accept the alternative hypothesis.
Hypothesis testing number 3. The question is there a significant relationship between the satisfaction of clinical instructors' guidance and the confidence level of students in handling high-pressure situations? My null hypothesis was that there is no correlation between how students perceive their clinical instructors' guidance and their confidence in handling high-pressure situations in clinicals. The alternative hypothesis is that there is a significant correlation between those two variables. So on this test, as you can see on the tables on the left, it is relevant because students' rating of their instructor's guidance helps to understand their experiences in clinicals. And the question asks, on a scale of 1 to 10, how well did your clinical instructor guide you through and give you feedback during your clinicals? It is relevant to our overall objective. And the second variable asks, how confident do you feel that the experiences in clinicals have prepared you to handle high-pressure situations? This is relevant because students' confidence level in facing stressful situations helps to understand their readiness for practice. For this specific hypothesis, it was a testing for monotonic relationship, and I used the Spearman's row correlation. This was because it ranks data, so the variable had to be either continuous or ordinal variable. In this case, both of my variables were ordinal. And they should also have a monotonic relationship between those two variables. My results came out that there is a moderate positive correlation that is statistically significant. The test statistics, or P, is 0.426, and the degrees of freedom was 31. And the p-value was 0.013. And since the test statistics was lower or greater than 0.344, the correlation is significant at the 0.05 level, confirming the result shown in the chart.
Hypothesis testing number 4. My question is trying to figure out if there is a significant relationship between how much applicable knowledge students have learned and how confident students are that they will succeed within their field of study. My null hypothesis is that there is no significant relationship between how much applicable knowledge students have learned and how confident students are that they will succeed within their field of study. Whereas my alternative hypothesis is that there is in fact a significant relationship between how much applicable knowledge students have learned and how confident students are that they will succeed within their field of study. This is relevant because this information shows how helpful not only the material is, but also the clinical experience is in preparing students to be confident and comfortable in their practice throughout their career as a nurse. When testing for a monotonic relationship, we will be using Spearman-Rose correlation. When looking at the results, because the p-value is significantly below the threshold of 0.05, we would reject the null hypothesis. This means we would end up agreeing with the alternative hypothesis and decide that there is a significant relationship between how much applicable knowledge students have learned and how confident students are that they will succeed within their field of study.
Hypothesis testing number 5. My question is there a significant relationship between the satisfaction of the clinical professor's teaching methods and their confidence in their preparation for their career post-graduation? My null hypothesis is there is no significant relationship between the teaching methods of clinical professors and the students' confidence in their preparation for their career post-graduation, and my alternative hypothesis is that there is a significant relationship between the teaching methods of clinical professors and their students' confidence in their preparation for their career post-graduation. Relevancy. So this is relevant because to determine the level of preparedness students feel for their future career, we had students rate how satisfied they were with the ways they were being taught. So the confidence in their skills from what they're learning can lead to the students' confidence in executing them into the field, which is why it was relevant. For this hypothesis, we used Spearman-Rose correlation test, and the results from it were that the p-value was 0.002, and the correlation coefficient was 0.524, and so because it's greater, since the correlation coefficient is greater than the p-value, we were able to reject the null hypothesis. So therefore, there is a significant relationship between the teaching methods of clinical professors and the students' confidence in their preparation for their career post-graduation.
Now moving on to answering our group results. First, what do these results mean when considered together in context? The experiences of nursing students during their clinical rotations are a vital part of their readiness for practice post-graduation. Because students learn a lot of academic and also interpersonal skills during these rotations, the guidance and feedback of professors and instructors are a form of direct feedback for their future performances and directly contribute to their readiness for practice. This includes confidence levels to perform procedures, patient interactions, and satisfaction in their specific chosen field of nursing.
Our second question that we answered was, what conclusions can you draw from compiling these findings? Only one out of all tested hypotheses was failed to reject the null hypothesis. Therefore, our findings support our overall objective in relating the perceptions of clinical experiences and their readiness for practice post-graduation. And next question, based on these findings and your conclusion, what relevance will they have to developing a holistic patient care plan? Our findings support that to develop a holistic patient care plan, students in nursing programs should maintain the amount of clinical experiences or even increase it. The more positive perceptions of the clinical experience nursing students have, the more prepared they will feel in practicing as a real nurse. Based on our findings, standard practices are not necessary to make changes for the improvement of existing patient care plans.
Lastly, we will reflect on the strengths and limitations of the study and implications for future research. If we had the chance to do a follow-up study, what might you do differently? Do you think your test results warrant further research? This topic is important because it is an indicator of the effectiveness of the current curriculums of nursing schools, specifically Azusa Pacific University, and it also highlights areas of strengths and weaknesses among the program. A limitation that we had in this study were that the accuracy of the data was diluted because of the significant number of respondents that weren't a part of the target population. And a potential future research or follow-up study topic could be the role of postgraduate transition programs in bridging the gap between clinical rotations and nursing job competence. Onboarding programs provided by healthcare institutions could play a critical role in bridging this gap. Investigating how these programs can influence perceived preparedness and job performance could complement the findings of our original study. Thank you.
Thank you very much.